Good afternoon, everybody. My name is Sally Tittle, and I am the SEND Manager, responsibility for stakeholder engagement for Wirral Council. We are delighted to join you today. We're pleased to have been asked, and we hope that what we talk to you about is of use to you in your local areas. On the first slide here, I thought it was really important to put the logos of everybody that's been involved with this piece of work, because it has been a collective effort, as you would hope, in terms of co-production, in terms of the local authority, our parent carer forum, parent carer participation Wirral, our youth voice, Send Young People, our colleagues at the NHS, and underpinned and supported with the local offer as well. Okay, next slide please, Mary. So, as I say, we're delighted to be here. Thank you for choosing to join this session. I assume that you have got interest in this area or looking to do similar by opting to come on this one, so we hope it's useful. We are a team of three. Sally, as I've mentioned, Janine, who has recently joined as the SEND Participation Manager, and last but by no means least, Miss Poppy Kane. Just confusing you with the name Leah on screen, which is actually her real name, but she's Poppy to us and always will be, who is our SEND Youth Engagement Officer. And I'm aware how lucky we are to have a SEND Youth Engagement Officer employed on a full-time basis. Poppy has worked in this role, been very dedicated and committed to the role for 3.5 years. She is Wirral homegrown SEND lived experience, part of our SEND Youth Voice group, who had an ambition to make a difference and to challenge processes and try and improve things for the future generations, born out of her own experience. And we have benefited by having that constant strand of youth voice and that conduit to youth voice sitting on our shoulder in every piece of work we do. So that's the team here today. We will all present this morning, this afternoon even. And the reason why we carried out this piece of work was on the back of visit from Ofsted and CQC when they came to Wirral to conduct our local area inspection back in October 21. So that inspection was the catalyst to bringing about the change and improvements that were very much needed. Now, co-production did exist. We had a charter, we had a project team. Poppy and I have sat on the Northwest co-production steering group for children and young people for as long as Poppy's been in post. So we were by no means not active or supportive, but we weren't doing what was needed. We were still lacking. So the report that Ofsted produced highlighted a lack of meaningful co-production with parents and carers, which obviously isn't what you want to read. As Philippa mentioned in the main session, at the end of the main session, also one of the other findings was that they reported a fractured relationship between parent carers and local authority and health colleagues. So the two kind of understandably go hand in hand. If you haven't got that working relationship, a mutually respectful working relationship with your parent care forum, then co-production is just going to be really, really tough. So and hampered. So we needed to do something differently. So action was needed, and we then had to ponder what we were going to do. Can I have the next slide, please, Miri? Because what we'd done previously clearly wasn't hitting the spot. What we did at this important junction was critical. We had to get it right. Too much time had been lost. There was missed opportunities, and we want to do things right. We want to make a difference. We want what we do to be effective. I don't think anybody sets out to do differently, but it was absolutely key. And so then there was a recognition that we need to do this together. everybody wants the same thing, so let's do it. So a lot of head scratching, and clearly there was formal processes to follow, given it was born out of an Ofsted report. Next slide, please, Mary. So the written statement of action was prepared. All stakeholders, as you would expect, were involved. And in terms of highlighting the co-production shortfalls, this set, the top 4 here, are what were devised out of that planning. It was recognised, again, as Philippa mentioned, how important it was for everybody to have a clear understanding, so a definition that is readily understandable by all. And that's not always the case. I'm sure you'll agree. Sometimes people think they know what it is, but in reality, it can be a variation of a theme. So that definition was the starting point. Also, the action plan, we were asked to review and refresh the then existing co-production charter. The mandatory training for all new staff was something new. It was welcomed by ourselves, because if staff hear it right from the very beginning, then they will have the awareness as they start their journey, their new employment, to look and seek out opportunities, because they're confident and clear exactly what is required when we're co-producing a piece of work. So before you roll out an agency-wide training package, makes sense to pilot it. So we were asked to put the package together and then make sure that we piloted 60 staff to gauge feedback and see if there was any further tweaks needed. Now, we did all this with the support of the RISE partnership, again, that Philippa Watts mentioned, and she led this piece of work on their behalf. We were very well supported. We were grateful for the opportunity. I think sometimes it's really helpful, isn't it, when an outside pair of eyes looks in. Sometimes we're just too close to a situation. So between Philippa and Saskia Jenkins, we received support for a period of several months, and I wanted to give credit where credit was due, that we definitely benefited from being involved with that partnership. Next slide, Mary. Okay, over to you, Janine. You're muted.
Thank you. Okay, so as Sally alluded to before, our starting point needed to be looking at the, sorry, I've gone, that's because I was muted to start with. We needed to look at our definition, and to make sure that we got that right, we needed to make sure that everybody had a say in that. By doing so, it's important to realise this doesn't happen overnight, and it takes many attempts, and it takes time to make sure that everybody gets their say and that their voice is heard, which is all the core of everything we're talking about. Also, it is always a huge temptation to be too wordy, to make use of sophisticated, complicated language that actually isn't necessary and isn't always understood. Parents and carers really helped us by helping us to keep it real and relatable, to make sure that this wasn't just a high-flying definition that didn't have any real context to it. And the young people, of course, helped us to keep it simple and to make sure that we said it as it is, and as I said before, not to overcomplicate it. So the definition we came up with was: children, young people, parents, carers and services work together as equals to make a change from the beginning. Being equal means that everybody's experiences, voices and ideas have the same value. All partners work together to identify what needs to change or to be developed, and how it should be done. And we have made those words that are really important bold, to stand out there, and that, make sure that we are really taking that on board. Okay, so our next step after that was to look at our co-production charter, or the understanding of what co-production is, and again, to keep it real, to bring it to life, to make sure it was relatable. So to do that, we held a Refreshing the Co-production Charter event, and the aim here was really to get some impetus to this, to really boost us on our way. And the attendees were a range of stakeholders. We had Wirral's Parent Carer Forum, we had our SEND Youth Engagement Officer, SENDIAS, the Director of Children's Services, and SEND practitioners from the triad of health, education, and social care. So when in part of this day, part of this event was to look at other examples of charters that are held up as being of good practice, of best practice, and we reviewed those alongside our charter. And we looked at what we'd really like in our charter, what's important to us as Wirral. We looked at our must-haves and the definitely nots, and they were all captured, and a draft charter has been formulated. And since drafting that out, the feedback from on that draft is really encouraging. So that's hopefully we're making tweaks as we go along before it's finalised. Before the event and after the event, surveys were completed by those attendees. And the really good thing that came out of that, it showed that there was an increase in confidence during the day in understanding what co-production was, getting a definition and understanding how and where it should be used. Thank you, Miri. Okay, so we've made this, as Sally said, that our co-production training is mandatory for all new employees, and that our existing employees were part of the pilot, part of the rollout, so that they can disseminate that to their teams. This has been endorsed by the senior leadership team, and we've now got our dedicated project team of Sally, Poppy, and myself. We benefited greatly from the input of parents and carers, children and young people, and other organisational areas to develop this. We've set out a really clear objectives for our workshop so that the attendees know what they're going to find out, what they're going to learn, and where it's leading to. We make sure that we back everything up with our statutory responsibilities and legislation so that we understand it's not just the latest buzzword. This is here to stay, and this is something that should have been here already, and we need to improve. We needed to sell the benefits of co-production to get people on board, to make sure that they understood. So whether they were SEND children and young people, whether they're our parents, carers, our practitioners, or are actually our decision makers and strategic leaders, we need them to understand the benefits of co-production. Poppy is going to touch on what the recognition of the 3 C's and the inclusion of Naomi, which is a really great framework that we can all follow. And in all of this, we made consideration, we took into account who we were actually, and moving forward, who we are delivering our training to, that it's we have a variety of audiences, and some audiences, some areas need tweaks. They don't need to hear some things, they do need to hear extra and additional things. So that differentiation is really important. Okay, so our training objectives that we want our attendees to gain by the end of their training with us is that we really want them to understand the value and the purpose of co-production. That they're able to describe the statutory requirement of it, and that they know that it is here to stay, and that they need to be making improvements and how they can make improvements, and to describe the difference between co-production, co-design, consultation, and to understand that there is a benefit for all 3 of those, and that it isn't a one size fits all. It needs to be, you need to use the appropriate C at the time, and to make sure it is the appropriate C, but also to make sure that the communication is running through. It is that thread that runs through them all, and without communication, everything falls down. We want them to be able to describe the steps that are involved in co-production so that they can apply them in their daily work, and also to understand the values of that and how they can put co-production into their everyday life. And most of all, I think really with all that, once they've gained all that, to be able to share the knowledge that they gain from the training with their colleagues, and to disseminate it down and make sure that that's cascaded through their whole team. Okay, so the national and international legislation. So this sometimes is skimmed over. People think it's a difficult thing to go through. It's difficult to read, and actually it can be quite wordy. I am going to read it to you. I know we can do it, but actually it just shows in the first, certainly in the Children's and Families Act, how wordy these things can be. And actually it's easy then to get lost. So local authorities must have a regard to views, wishes and feelings of participating as fully as possible in decisions, being provided with the information and support necessary to enable participation in those decisions, needs support to facilitate the development and to help children and young people achieve the best possible educational and other outcomes. As I said, quite wordy and easy to get lost in there. So the UN Convention on the Rights of the Child in Article 12 states that every child has the right to express their views, feelings and wishes in all matters affecting them, and to have their views considered and taken seriously. The Care Act 2014, local authorities should, where possible, actively promote participation in providing interventions that are co-produced with individuals, families, friends, carers and the community. And the NHS Constitution Principle 4, public patient and carer voices are at the centre of our healthcare services, from planning to delivery. Every level of our commissioning system will be informed by insightful methods of listening to those who use and care about our services. So these things have been around for a while. This isn't brand new. It's nothing new. However, it isn't widely being used, and we really need to be promoting that now and understanding that people, services are taking into consideration the views and young people views of children and young people, parents and carers, and any stakeholder that is affected by their changes that they're making. Thank you. I'm going to hand over to Poppy now, who's going to tell us about selling the benefits to our different stakeholders.
Thank you, Janine. So the benefits are for children and young people are they and their experiences are valued. Having someone listen to your experience and being able to share what might have been a negative experience, and people taking it into consideration and making sure that it's not going to happen again in the future. Building the trust of adults supporting children and young people. The key thing for young people, for them to be able to share their experiences and things that might have gone wrong through growing up, it's really hard if you haven't got the trust of the adult that you're talking to. Support meets their actual needs, not perceived needs. We're not assuming that every child's needs are the same just because they might have the same diagnosis or they go to the same school. We are all completely different no matter what label you have. They make progress in everything. The key thing that we talk about in the SEND voice groups are transferable skills. The things young people gain from being part of co-production and the 3 C's is incredible. The confidence, the skills to be able to communicate in different ways, to express yourself and just feel empowered that you're being able to help not only yourself, other professionals, but the children and young people coming through the system behind you. For parents and carers, again, their experiences are valued and their expertise of their child and their child's experiences are valued. The empowerment it gives a parent and carer to be able to share that and know, again, the difference that's getting made. It gives trust in the system and in the individuals. It's parents and carers tell you it's a fighting battle going through the system. But actually, if we include them in co-production and build the trust, it doesn't become a them and us. It becomes a let's all work together and make a change together. And then hopefully as well, the tribunal, the complaints, everything should go down because we're working together and we're making sure the system, any faults that might be in the system, can be changed through people's experiences. And we're not just a name who's emailing them or an EHCP coordinator who's drafting a plan. You're an actual individual. Understand the system and how and why the decisions are made. Until you're in the background of the local authority or until you're included in meetings, you don't know how the background works and the genuine reasons why decisions are made. And the most important one is the child or the children's needs are recognised and met. So we're all winning from that. The family, the child and young person, the parents, the carers. For the practitioners, it builds strong relationships with family and service providers. And we're able to use resources effectively. And a huge thing, make savings, save so much money when you do it right the first time, including the people who know what's going to work and what isn't going to work. It gives you motivation because you know that you're making a change to not just the young people, but to the generation coming forward or the ones in the system at the minute. The knowing that you're making a difference as well, the confidence you get and the pride you then take in your job because you know you can do it. For strategic leads, it's making sure the families are put at the heart of our decisions. And it gives us evidence-based decisions so we can prove why decisions have made and why we might have cut something else and provided something else. You're able to share the power and accountability across all of the stakeholders, and you can respond to changing contexts. For decision makers, you're able to become more responsive and relevant, and you can offer a useful service rather than something you think will be useful to people. It gives you ownership and helps champion the services that are working well and making sure that we're not funding services that might not be working for young people that we think, oh, they sound great. It reduces us versus them dynamic, like I said earlier, the reducing tribunals, the complaint rates. There's trust in the system and there's people understand why the decisions have been made. So then tribunal and complaints go down and the relationship becomes more positive and it gives you a better understanding of lives and experiences of the people we're supporting. Thank you. Then 3Cs. So we know whilst co-production is always our aim, but we recognise there is a time and place for co-design and consultation. All of these ways of working must include children and young people and or parents and carers as appropriate. So our 3Cs, here's our definition. So co-production is children, young people, parent and carers and services working together as equals to make a change. Being equal means that everybody's experiences, voices and ideas have the same value. Co-production happens when all partners work together to identify what needs to change or be developed and how it should be done. Co-design is when one or some partners have identified that something needs to change or be developed, and they work with all partners to decide how to do it. Consultation is when one or some partners have identified that something needs to change and be developed, and they have a plan for how to do it. but they work with other partners to check the plan is a good idea and is likely to make a difference. They make changes to the plan in response to what other partners are telling them. So when we were working with RISE, the idea we had was co-production. If you think of it as a blank A4 piece of paper with absolutely nothing on, we're going to create that together, and we're going to be able to fill that sheet together. Co-design, we've got the title and maybe the first introduction paragraph, but the rest can be changed. And consultation is the sheet is filled, but we've done it in a rub out pen, so we can change it and we can make the changes, but it's already been created. The 3 C's, we do have a 4th one, but this one is the most key and underpins all of our 3 C's, which is communication. So we must have clear, accessible communication through all of our 3 C's. Thank you. So our Naomi method is the good practice and framework for planning, monitoring and evaluation. It incorporates every stage a project needs to go through and breaks down the planning phase into smaller chunks. Thank you. So breaking it down. So this is how we've used it in our practice developing this workshop. So the need. Why am I engaging with this person, these people, these stakeholders? What is in the process for me and for them? So we create a shared understanding, strengthening relationships and improved practice. Our aim, what are we trying to achieve together? So to share our approach and our initiative practice to benefit colleagues nationally. Our objectives or outcomes, are we all clear and do we all agree? So develop a workshop to a multi-agency audience and leave them equipped to model the embedded one in Wirral. Our method, how are we going to do this together? Where we inform participants of the method used to date, signpost to reference point and follow-up engagement. Our implementation, putting the plan into action. Here we are today doing this. Our evaluation, the key to all of this, the feedback, the post-workshop evaluation and the level of interest, making sure we give feedback to all stakeholders, whether it's positive or negative, is building the trust in the relationships. I'm back over to Sally.
Thank you, Poppy. Thanks, Janine. Okay, Coke. So I think it's probably important to give you a little more detail as to how the pilots ran. So we're working on a tight time scale here because clearly we will be re-inspected. Co-production done properly can take time, it can be quite protracted. So we wasted no time having got our definition nailed down, having got a more purposeful and accessible charter ready. We put the pilot together. As I mentioned, we were tasked with ensuring we reached out to 60 staff to canvass views. Pleasingly, word after the first session was delivered got round and people were actually asking to come and hear about it. So we did in the end deliver 3 sessions as planned, but we reached out to 68 staff. And they were frontline staff working within SEND across health, education and social care. Now, pleasingly, the sessions, all 3 sessions, were co-delivered. We were supported by RISE still at that stage, ourselves as participation engagement staff at Wirral, but also our DCO, fabulous DCO from health, was one of the presenters, young people, and last but by no means least, representation from our parent carer forum. So it was, I think it signalled a very clear message that we are committed as a group, that we have come together, and the training delivery benefited hugely from that. When we were considering the content for the training, we felt as a group that there was additional snippets of information that would benefit commissioners, and rather than build that into what was already a morning's training session, we committed to delivering separate session for our commissioners, which we've done with that more specific commissioner element, given that, as we said at the very outset, the process of co-production involving everybody starts at the very beginning, and clearly commissioners are very instrumental in that early stage of getting the ball rolling when we're looking at new services or change to provision. We spelt out very clearly when we delivered the pilots that we wanted to hear from the audience. We weren't precious. We were hoping that they would apply a common sense, say what you see approach to the feedback, and that we were welcoming it. So throughout and post-event, we sought their feedback, and as a result, each session varied because we took on board comments and tailored the next session to improve and make it better than the one before. And I'm sure we'll continue to do that as the main rollout develops. The feedback that we received from those 68 was real positive injection for us. It told us we're on the right lines, that we are delivering the objectives that Janine set out for us, and that not only is there a greater understanding of what co-production is, there's actually an appetite to go away within services to seek out and perhaps be that bit more creative, to manufacture sometimes, or to certainly not miss opportunities to co-produce a thing, a project, a service. Thanks, Mary. Where Wirral are at now, so we've delivered the pilot, that has been really well received. On the back of that, RISE were delighted, given we are the only local authority to date delivering training to our staff and our local area, our colleagues in health as well, on co-production, and to be included in this session's lineup today is something that we're very proud of. We're proud of what we've done, but we mustn't rest on our laurels. So the next step is to roll out to the remaining staff to ensure that the inclusion of co-production, the information that we're sharing when new staff are carrying out their induction, is appropriate and tailored in terms of length and content to enable them at the very start, the very outset of their journey working in their new roles, to enable them to play their part. We heard out it's everybody's responsibility, we're bound by legislation, so let's just make very clear at the outset of a new appointment expectations in terms of legislation and how that can work into their new role. We are going to deliver a model of the training along with our parent carer forum to parent carer audience across Wirral. We'll do the same for our Send Young People. Poppy will play a leading role in that, along with the Send Youth Voice group, who are particularly high profile in Wirral. I'd suggest an area of real strength. So they are very keen to get going and help Poppy in her mission to drive through the improvements and get this message out. We are also, rather excitingly, hosting an event this spring, a co-production event. Sometimes when you're in effect breathing new life into something, to be able to meet people and keep that momentum going and to give examples and case studies of where things have worked well is really important to keep with that buy-in. To answer the lady who's just put the question up, the pilot sessions were delivered online. They were delivered online in terms of tiny bit of the remains of COVID. The timescale that we had and also the impracticality of having the RISE partnership staff keep travelling up to the Wirral. So the pilot was done online. The training packages for new staff, there'll be a mixture of online packages for them to work through, with the opportunity to follow up with a face-to-face with the SEND-P&E team, and the rollout of the remaining training I'm hoping is going to be face-to-face, because that will be a structured programme of delivery. Okay. I dare say there will still be a modicum of online sessions as well.
When you say online, you don't mean e-learning, you mean you delivering that via Teams type
when I
thing.
say online, I mean delivery by Teams, but I do
that's
think
what I thought you meant.
I do think the new recruit stuff will be done through an e-learning package, but then supplemented with Janine, Poppy and myself adding more meaning to it.
Thank you.
Is that okay? Yeah. And then we have produced a new logo that we will use as a kite mark, if you like, just to endorse where a piece of work that we're really pleased and confident has been meaningfully, genuinely co-produced. That logo, which I appreciate reads right to left, will be put on a pride place, whether it's new paperwork for EHCPs, annual reviews, whether it's you know, a piece of work that we've done with health colleagues or with social care, or indeed pieces of work that we're already undertaking with our parent carer forum. We're hoping to be able to see that logo increasingly on more and more Wirral based products. And then next slide. Miri, please, thanks. We used all these resources when we were putting our training together, so we wanted to share with you so that you can just save you a bit of time really and pull together the stuff that we found really useful. The Naomi method that actually Poppy brought to the table has been invaluable, and the planning and evaluation methodology handbook there in green sets out more information about Naomi, how to use it, the benefits. I just think it's a really useful way of breaking things down into manageable chunks and to keep you on track. So we wanted to share those with you. And then last but by no means least, we wanted to leave our contact details for you. So if you've got any follow-up questions, any points of interest, anything you think we've missed, anything you'd like to hear more of. We appreciate that what we've done here in Wirral is what we needed to do here in Wirral, and you, if you're going to emulate or maybe try and replicate to some degree a tangent of what we've done, it will need to be within the context of your local area. So we're not trying to prescribe or say, you know, here it is, do it like this, because you'll need to do it slightly differently to us, I'm sure. But we've tried to give you the outcomes, set out the legislation, the information to help you be better informed perhaps, and also those selling points, because I think, you know, when everybody's trying to cram everything they've got to do within to their working week, to be able to use some of those really good examples that Poppy talked us through. Whether you're a commissioner, whether you're talking to a group of young people, it's just nice to be able to pull some key benefits out. And if you've got any case studies where it's gone well, obviously that's real life examples that people can certainly relate to. So please don't be shy. We're very passionate about what we do. We strive to do the best we can with what we've got, and we're proud of what we've achieved. So please don't hesitate to get in touch either through myself, Janine, Poppy, or Miri will also field questions on our behalf. But thank you so much for choosing to join this workshop today, and we really hope it's helped.